So, and this is a trick that a ENT surgeon taught me. So I'm applying the sodium bicarb here, do 2 rounds, so you can see it kind of slink in there into the recess. And apparently, it's never really worked for me, but anyone who knows about optics, or if there are any optometrists out there, please let me know. But one of the things that happens sometimes is that if you apply the water or the sodium bicarb into the recess, sometimes you can see in via a fisheye effect, via refraction perhaps of the light. I'm not really sure if that works. It's never worked for me. But anyone in optics, please let me know if that's a thing. So we'll just get some focus here. You can see the bubbles of sodium, bubbles of carbon dioxide, excuse me, starting to rise. You can also see these pale flakes of dead skin here. And there we go, there's some good focus on it. So you can see those pale flakes of dead skin starting to rise there. So there is, some action going on there, some active action of that fizzing going on, which is somewhat helpful. To be honest, I rarely use sodium bicarb. I very rarely recommend it. In fact, I never recommend it other than if there's stuff on the drum. So I tend to recommend olive oil. And I very rarely use it during procedures. The reason is that it often leads to an itchy ear. So if somebody comes into the clinic and they've used sodium bicarb for more than 3 or 4 days, I'll usually find that the ear canal looks a little sore, and they usually complain that their ear is itchy. And that's probably because of the same reason why you get sort of dry skin or hangnails or itchiness on your hands if you're constantly washing them without moisturizing them. Or if you're dipping your hands in water all the time, you'll get dry skin. And that's because your skin is supposed to have that kind of natural protective barrier of oils and fats on the surface of your skin, on your epidermis, your corneocytes. And when you're constantly washing your hands or dipping them in water, you're taking that layer away so that the moisture escapes out of your skin. So that's probably what's happening here when somebody's using sodium bicarb drops and their ear canal gets itchy. So I don't tend to recommend it that much. And I find that, often if they use sodium bicarb enough, it creates this kind of soup or slurry in the ear canal, which I've mentioned many times before in previous videos, which is very difficult to clean. And, in this case, the patient has used this bulb to shove the earwax right down mechanically. But often I find that if enough sodium bicarb is used, it'll create this kind of soup or slurry, which then slinks right down against the eardrum, which again creates its own problems. If you're interested in seeing that case where I'm suctioning a sodium bicarb treated eardrop, then I'll link it down in the description box below. And if you're interested in also finding out how hydrogen peroxide eardrops work, which is kind of similar, then I'll also link that in the description box as well. Hydrogen peroxide also fizzes in a similar way to sodium bicarb, but the product is water and oxygen, which is in most cases the reaction that you'll get if you use hydrogen peroxide. So I'm just suctioning stuff out of the recess here. There's going to be no sodium bicarb in this ear, but I just wanted to include it at the end because it's a very nice, clear example of how these little ear douches can go wrong. But this ear is looking much, much better. The eardrum on this side is not nearly as inflamed. And I'm just pulling stuff out of this little recess here. This is the anterior recess, so the anterior being towards the nose or towards the front. And the anterior recess is on the right-hand side of the frame. So I'm just starting to clear up this debris here. And I should, again, this should result in the patient's symptoms being pretty much cured. So again, the eardrum and the ear won't look pretty because there'll still be kind of smatterings of brown wax here and there. But again, the patient will be in a much, much